Our third group we'll be hearing from is around neural and AI-enabled bionics, and with thanks to our judges, Dr. Nigel Greenwood, Dr. Juxie Leitner, and Elise Hogan. So thank you so much for making yourselves available and sharing your expertise with us today. Really looking forward to your thoughts and insights. Now, this category is about next level discoveries in brain-computer or brain-machine interfaces and neurobionic treatments, AI-driven organ software, and prosthesis or other devices. So a really exciting, interesting category, the merging of technology and obviously the body, and really keen to see how some of the project teams have evolved your presentations and solutions. Now, first up we have Dr. David Painter, and he's going to share with us their project targeting AI-enabled analysis of cognitive prosthesis for spatial attention recovery following brain injury. So David, really excited to see where your project has come. Are you online and ready to present for us?
Yes, I'm ready to go. How are you going?
Good, thank you. Just check your audio if you don't mind. That was a little faint and maybe a little muted. Just try that again.
Bring it a bit closer, is that better?
Yeah, much, much clearer, thank you. So just start sharing your screen and maybe how's your morning been? I might just get some more sound out of you and see how that's going.
It's good. I managed to tune into some of the earlier talks, which were pretty interesting. And yeah, you could definitely see the progress across the competition. So they're exciting.
Absolutely. Yeah, no, that sounds quite good now. Thank you, David. What you were using at the end there was spot on. Your screen is up, very clear. The judges are ready, so we're all ready to hear. Take your time, relax. Really looking forward to seeing how your project has progressed. So over to you. Thank you, David.
Great. Thanks very much, and thanks everybody for coming. For clinicians and brain injury survivors who need effective and evidence-based rehabilitation techniques, the AI-enabled spatial attention training system is a cognitive prosthetic that promotes recovery and survival following brain injury. One of the key cognitive abilities is spatial attention, which allows you to find objects in complex scenes. So for example, imagine you're looking for your keys. You can look at that scene in each location in turn, thereby finding your keys. That is, of course, unless you have spatial neglect, which is an injury to the right hemisphere of the brain, and inability to focus on objects in the left visual field. So your search for the keys may look something like this. Here is a picture of a person with neglect, and as you can see, they're focused on the right side of visual space. In clinical settings, neglect is assessed using pen and paper tests. For example, to draw a clock, and here you can see the clock is drawn on the right side, indicating the person has neglect. Limitations of pen and paper include that they cannot measure neglect severity, they cannot detect subtle cases, and they can be cheated. That's why we developed an attention atlas, which is based on virtual reality, VR. The person wears a headset and they use a controller, and we present objects surrounding them in 360-degree space for them to find. Here is an example of the attention atlas in progress. The person here is looking for the number 6 among rotated numbers. And meanwhile, we can measure their spatial attention using the headset, using their eye position, and using the controller, thereby creating detailed spatial maps of attention. Here are some example attention maps. This is from a person with brain injury without neglect. These dots reflects an episode of attention. And as you can see, these dots are evenly distributed across the visual field, thereby indicating even spread of attention. Here is an alternative representation. Red reflects headset attention, green hand attention, and blue eye attention. Together, they create these colorful attention maps. The attention atlas measures attention. We can improve spatial attention following brain injury using cognitive prosthetic. The cognitive prosthetic is based on modifications of a popular driving game, including using VR, a steering wheel and foot pedals, and creating custom driving tracks. The rationale for immersive driving is that it exercises spatial attention at multiple scales, At larger scales, driving allows the direct experience of vast space, the open road. At smaller scales, driving requires 360-degree attention, including to the road ahead, the vehicle's current position, and other road users. If we combine the attention atlas and the cognitive prosthetic, we have the AI-enabled spatial attention assessment and training system. The idea is the cognitive prosthetic trains attention, which we can assess using the attention atlas pre and post. Beyond that, we can use AI to improve the efficacy of the system by investigating the relationship between the attention maps and driving skill, and between driving skill and attention maps after the intervention. This combination allows us to change the cognitive prosthetic to focus just on those driving skills that are most closely related to the recovery of spatial attention. Our beachhead market includes clinicians and brain injury survivors. Queensland statistics include 77,000 stroke survivors, 26,000 with disability or neglect, about 1/3, and 15 stroke units in public hospitals. Our strategy is to develop the AI. We have a Queensland strategy, big data acquisition using AI to predict recovery from attention map data. And we have a Gold Coast strategy to develop the spatial training system, leveraging AI to improve efficacy. Our business strategy includes a vision to deliver cost-effective recovery solutions accessible to all. And we propose a video game model where we allow free access to clinicians, inpatients, but we sell to end users at scale in return to home. Our team includes a neuropsychologist, a cognitive neuroscientist, a neuroengineer, and a VR expert. For clinicians and brain injury survivors who face rehabilitation techniques, the AI-enabled attention training system is a cognitive prosthetic that promotes recovery and survival following brain injury. Thank you.
Fantastic, David. Thank you so much for your presentation. Let's move on now to our Deep Brain Connections wearable devices for neural robotic control. And we're going to hear from Nat Marshall. So Nat, if you're feeling pumped and ready to go, let's test your audio and get your screen sharing, and we can jump into that. Audio in and out a little bit, I think. I'm not sure.
Is there an issue with that? Or
no, it's actually come good. That's okay. Thank you. Screen is up and just about to share. There we go. You're up and ready to go. Looking good. Deep breath, relax in your own time, and really looking forward to your presentation. Thanks, Nat.
Thank you. Hi, I'm Nat Marshall, founder of Deep Connection. I just wanted to start this out by asking everyone to take part in the thought experiment. Imagine for a moment that you only have one arm. Think about how your life would change. Think about all the things in life that you take for granted that will become a challenge. And now think about the fact that there's no way to regain the function that you lost. It doesn't matter how much money you have, it doesn't matter where you live, and it doesn't matter who you know. There's simply no way to regain the control that you lost. People living with upper limb loss are not asking for anything crazy. They're just asking for some of the function that we all take for granted. They're facing an industry that's resistant to change, and they're being asked to pay ridiculous amounts of money for the smallest amount of control. In the digital world, connection is vital, and this is something that's sorely missing from robotic prosthetic solutions. There are 110,000 people facing this situation every single day in Australia and the United States, and they're being asked to pay $50,000 to return the smallest amount of control, and this simply isn't acceptable for them. Current robotic prosthetic solutions are not meeting the expectations of the end users. They're not making use of artificial intelligence and machine learning technologies. They can only produce a small number of gestures and simple actions like contractions and extensions. This means the costly robotic prosthetics usually end up taking a supporting role. We've developed a process that allows able-bodied participants to lend a hand through artificial intelligence. It learns how the muscle activations create hand movements, which can then be transferred to someone living with upper limb loss. Our hardware has been specifically designed to leverage state-of-the-art machine learning models to provide fine motor control. This is seen in the hardware through the increase in the number of electrodes, from the industry standard 16 to our 256. You can imagine this as an image of your muscles, which would provide a clearer image of what's happening, a 2 by 8 pixel image or a 16 by 16 pixel image. With more muscle data points, we can collect more data, we can make better use of the data, and we can provide fine motor control to a robotic prosthetic solution. After speaking with end users, it's clear the most important aspect of the project to them is function. We've received letters of support from prosthetic providers, primarily due to the unreasonable cost of current solutions. They face the issue that most control units are not covered by the NDIS due to the high cost, and they've stated that a reduction in cost would likely lead to an increase in adoption of the technology. For clinicians, the primary interest for them is improving outcomes for patients. They want to be able to offer a solution that can provide better functionality for their patients. We collect more data, which in turn leads to better feature extraction used to provide fine motor control. Our software is intended as a general solution, which can then be fine-tuned to each patient's needs. The product we're developing captures most of its complexity in the software, and thus a reduction in cost is expected. The process we've developed underlies the whole technology and provides us with a defensible IP position. The Bionics Queensland project is intended to fast track us towards an MVP, and this will cover 3 key areas: a landing page to describe our product and company to customers, filing a PCT to initiate international IP protections, and finally, finalizing a prototype to lay the groundwork for an MVP. The point of the Bionics Queensland project is to bring us to the stage of an MVP. One of the major hurdles for medtech startups is the long pathway to commercialization. We're in the fortunate position that there's an immediate application in virtual reality as a consumer product, and we will be able to fast track to a revenue stream whilst progressing down the medical device pathway. We have a team of advisors with a diverse range of skills, including machine learning experts, business development and commercialization experts, and an orthopedic doctor. Thanks for listening, and I'm happy to take any questions.
That was great, Nat. Thank you so much for your presentation. Awesome. Let's move on to our next presentation if we can. That's Intuitive Grasp, wearable device for restoring hand function. And for that, we're going to hear from Dr. Antonio Padilla Lanari-Bo. How'd it go with your name? Antonio. So I'm a Mark Jones. You have to forgive me. I've never had those challenges. So.
All right. So I'll be presenting in terms of in representation of the team. So
of course.
I'll be sharing my screen. Just let me know if you can see the slides and if you can hear me. Okay.
Thanks, Vanessa. You're coming through loud and clear, and the slides are about to go into presentation mode, I think. I'll let you know when they pop up.
Yeah. It's not going yet. Can you see that now?
Yes, we've got the image of the gentleman in the wheelchair.
Yes.
Great. In your own time, whenever you're ready, really looking forward to seeing how your presentation has evolved. Thank you.
All right, so tell me I'm not the only one who has struggled with coming to terms with my office and the house being on the same. We are all using our computers, the keys, the mouse, the gestures we all take for granted, and even the speech that I'm now delivering to the birds in my backyard as an audience. Now imagine that you don't have or have very little hand function, and you're unable to do all of these important things in life, especially in these challenging times. This shows the importance of our hand in everyday life activities, just to get around, manipulate objects, and interact with other people. Well, this is a reality for someone with a traumatic brain injury, a stroke, that has some sort of hand dysfunction, but also it's a reality for someone with a spinal cord injury. Spinal cord injury is a lesion that is affecting 50,000 individuals worldwide. These persons face many challenges in their everyday life. And this is due to sensory motor deficit, but also they have metabolic and cardiovascular disease as a high prevalent feature. However, for persons with tetraplegia, the most important thing is the recovery of hand function. And tetraplegia in spinal cord injury in Australia is 50% of the total people living with a spinal cord injury in Australia. So this is really important. Current solutions for hand recovery are coming from different interventions, such as tendon and nerve transfers to passive assisted devices designed to a specific task. However, these alternatives are very hard to use, and the degree of hand control recovery is usually limited. In addition, some solutions are quite expensive, and the recovery is not really guaranteed. So what we propose with our intuitive grasp device is to provide this solution in a very unique way, as we are going to provide a higher degree of control of finger movement while still being very intuitive to use. Our proposed device is also non-invasive, it looks natural, and is water resistant. So what is special about this device? So this device is a combination of novel electrical stimulation approaches and soft robotics to support the finger and wrist movement. Very interestingly, to control the device, the user residual function is interpreted by machine learning algorithms that will provide an easy-to-use control interface. So our team is composed with clinicians and engineers with years of expertise in technologies for restoration of hand function, but also with a lot of expertise in clinical evaluation and commercialization. We are really committed to bringing this life-changing solution to both individuals located in metropolitan areas all throughout Southeast Queensland, as well in those very important areas in regional and rural communities in Queensland. So I'm a lecturer here in Rockhampton. I'm a lecturer in physiotherapy, and I'm the clinical leader of the team. So I'll be providing this expertise in working in rehabilitation with people with clinical conditions, but also be providing connections within the community and organizations, specifically in these regional areas. Together with the other members of the team, we have a strong commitment and strong connections to make sure that this device becomes available. So to bring this idea into the world, we have established this work plan. We have a long-term ideas to bring the solution to the market, but currently we have placed focus on bringing the product to technology readiness level 4. That is to conduct pilot tests. We have already one patient willing to participate in our pilot testing. We anticipate that other patients will be expressing their interest in the use and co-development of this device. Once we reach the dash line, there are several pathways we have considered. One alternative will be involved to manufacture this device and commercialize, but also we are evaluating very important alternatives in terms of rehabilitation, such as physiotherapy and occupational therapy, but also offering training packages for clinicians in the healthcare facilities and also to healthcare students. So I have one question. If you have a physical disability and you would have some sort of impairment in your hand, how great would it be if you could have access to a device that could replace that important hand function, but also be user-friendly, affordable, and intuitive? That way, we will all be able to hold the birds as well as pitch our ideas to them. Thank you.
Wonderful. Thank you, Vanessa, and a great presentation. Our last presentation for the day, and obviously I've got to say this for you, Casey, we do save the best till last. It's a policy we've had for quite some time now in our inaugural year. But your presentation is on Cortex brain-computer interface. And Casey, you're a wonderful presenter. I really am looking forward to seeing how your project has advanced. Are you ready to go?
Ready to go. Yeah.
Awesome. We'll get your screen sharing, and we'll double check that that's all coming through cleanly. There we go. That's coming up now, and I'll let you present. Great.
Ready to go?
Well, we're in your hands, Casey. Kick us off whenever you're ready.
Okay. Let's go. Hi, my name's Casey, and I'm the founder of Cortex Brainwave Technologies, and we're building technology that changes minds. This is my daughter, Ingrid, and I love her more than anything in the whole world, and I'd do anything to help her. But I can't help her with the issues that she has around autism and ADHD. Issues like concentrating at school, or being able to retain information when she's trying to learn, or staying on task. All of these issues I know intimately because I also have autism and ADHD myself. During my career as a scientist, I was searching for a therapy to help my daughter and myself, and I came across an emerging therapy called neurofeedback therapy. Now, neurofeedback harnesses the brain's ability to learn by triggering the same process that you would have in learning how to use an arm or a leg. And it can also be used to reset and readjust connections in the brain that aren't working to their optimum. And it's been shown in clinical studies and registered as a clinical therapy for ADHD as of last year. Now, it helps in areas that are all very common in autism, ADHD, and traumatic brain injury. Areas of concentration, emotional regulation, learning, and memory. All areas that really make it difficult to enjoy your life if you don't have them. What I found when I was looking for a provider of this therapy, however, was that the therapy is uniformly high cost, it's uncomfortable and difficult to set up, which means it has to be set up in a clinical setting, and it's very prone to signal noise. So most systems are based on EEG, and that is very prone to external signal noise. Say, for example, the ceiling fan above me is causing electrical signals that would make it impossible to use this kind of system. So what Cortex is doing is to develop a light-based imaging system that allows us to image inside the brain using a non-invasive measure and using proprietary developed sensors and hardware around the headset, as well as proprietary software that we'll be protecting using legal means. Now, we are developing this because we couldn't find a solution for what we're trying to do. And it will help so many people in these areas. What we're doing is to target the niche of high ease of use and moderate cost. And we're looking to try and create engaging and fun games, because that means that the therapy works a lot better. When you engage, you improve the outcomes of neurofeedback. The Australian total available market is approaching $600 million for autism, traumatic brain injury, and ADHD, and no solution exists for these currently for these customers. We are initially starting with a B2C model for our pilot trials and early adopters, and we have interested parties in Queensland who are ready to go with this once we have our MVP to work with. From there, we'll leverage into B2C sales and expand into further markets. Now we switch to Amy Rose. Amy Rose? She might be cut off.
Yeah, I don't think people were aware that I was going to be speaking
That's all right.
in the second half. Okay.
Go for it.
I'll just continue. Hardware and software are holding back the gaming, VR, neuromarketing, medtech, IoT, and bionics industries to the point we're in desperate need of innovation. And these industries are dependent on the development of this tech. And this is where Cortex Brainwaves technologies come in. We are a strong and diverse team with the skills and experience in neuroscience, manufacturing, scaling, design, and electronic development. You can't really see it in these photos, but we're actually all wearing capes. We have a solid foundation of advisors with a world of experience, and we are collaborating with some of the best Queensland-based industry leaders.
We are planning to meet these following milestones with help from Bionics Queensland. And with your help, we will change minds. Thank you.
Wonderful team, great presentation. So thanks again, everybody. Have a wonderful rest of your weekend. Thank you, Robin, for your amazing efforts. And judges, stay with us, and we shall continue that judging process. And everyone else, have a wonderful weekend. Thanks for your participation and efforts. Much appreciated. Well done.